is considered the epicenter of the monkeypox outbreak in America. The city has about a third of all cases in the country.
And it appears that the city has fixed the problem of the online vaccine appointment booking system breaking down, but we still don't have enough doses.
Now, here to tell us the latest is City Councilwoman Lynn Schulman. She is the chairperson of the council's health committee. Ms. Schulman, thank you so much for being with us.
Thank you for having me.
All right, so more than 9,000 appointments were made available Friday, and they were gone in like 7 minutes. So why is the city still holding back another 4,000 doses?
The city wants to make sure that people get first doses of the vaccine because you actually need 2 of them. And the governor actually over the weekend got the federal government to give the state another 32,000 doses, of which we expect to get a large majority of that.
I mean, this is coming out so piecemeal, and you have people who are clearly so desperate to get access to the vaccine. What is your estimate of how many doses we actually need in the city? How many are we short at this point?
We're short thousands upon thousands of doses. The CDC and the FDA have held up the doses coming into the city, and it's a travesty. I spent my personal and professional life on healthcare advocacy, which was born out of the HIV/AIDS movement, where I saw neighbors and friends dying needlessly because of the indifference of those in power. And we're seeing that. We saw that with COVID, and we're seeing that again with monkeypox.
Well, let's talk about who you think is falling short here. The federal government, obviously, for not having the doses. But how about the city for the appointment website? There were some issues with that.
The city had a number of serious glitches and problems in the beginning. They're coming around in terms of coming together on that, and I've been working with them. The city council's been working with them. The LGBTQIA+ caucus of the council has been working with them. In fact, we're having a town hall. The speaker, Adrian Adams, the New York City Council speaker, and I and the LGBTQIA caucus are hosting a town hall with the health commissioner today at 4 o'clock. It's open to everyone, so people can sign in for that.
So you brought up HIV in the past and your experience with that. You brought up COVID also. We've learned a lot about vaccinating, about treatment. What is the federal government not seeing here in giving New York, which is the epicenter of this outbreak, the prioritization that it needs?
It's a real problem. Everybody has come together. I sent a letter to the CDC as the health chair last week that was also signed by the LGBTQIA caucus of the city council to get them to release the vaccines. The FDA, the federal government is just falling down on this. We really need to get those vaccines. And also, one thing you didn't mention is we need testing. The CDC, as it did with COVID, is controlling testing. What labs can give the tests and everything else. So we're trying to push on that score as well.
All right, so there are 4 vaccination clinics in operation now. Is that going to be enough for the entire city?
No, I think my understanding is that the more vaccines we get, the more sites will be opened up and the more appointments there will be. So the key here really is getting more and more vaccines into the city.
And we've seen that the disease has really been hitting hardest in the gay, bisexual, transgender male community. Anybody, though, can get this. Rarely fatal, though. Is there more that we can be doing about spreading information to the broader population about prevention in this space?
Yes, and one of the things that the city council is going to be doing is a night of action at the end of this week, where we're going to go out to bars and different places where the LGBTQIA community congregates, giving out information. So we're working with the city, we're working with the Department of Health on this, and we're working with the LGBT advocacy groups.
All right, that is Lynn Schulman, chair of the City Council's Health Committee. We thank you so much for joining us this morning, ma'am.
Thank you so much for having me.